Good evening to you and thank you for joining us on Health and Wellness. My name is Zaitun Ali, and on today's episode we want to discuss about the conjunctivitis, which is commonly known as the red eye or the pink eye. Now this is an inflammation or irritation that happens at the conjunctiva, in the white part of the eyeball, and it becomes red. And right here on set I have Daktari Msafiri, karibu sana. And he'll be able to explain this and more in scientific terms as better as possible than I have done. Karibu sana.
Thank you.
And as we are talking about this, it came as a shock, especially to Kenya and Mombasa County, that we got this disease. Is it a disease? Is it an infection? What is it exactly?
So conjunctivitis, or the pink eye. I think here conjunctivitis is a very long name.
Very. You've seen me trying to cram it.
Yeah, but basically what it means is, so the eye has different parts.
Yeah.
But just basically the black part that people see, the people are aware, that's the iris. And then the white part is what we call the conjunctiva. Okay. And so that's the part that gets what we call inflammation. And inflammation, anything, when you hear the word itis, conjunctivitis, pruritus, all those, they just mean inflammation. Okay. When they add the word itis. Arthritis.
Oh, really?
Yeah, it's inflammation of the joint.
Yeah, okay.
So anything that has itis, it just means inflammation. And when you're talking about inflammation, there are certain things that happen. One is what is called the redness, so which is what people see. What people call the pink eye. It's actually pink, not red.
By the way, why are Kenyans calling it the red eye?
It's because when you translate, macho yako imekuwa nyekundu.
Nyekundu. Red eye.
Yeah, so they call it red eye, but actually it's pink eye.
Okay.
So even when you Google, that's what you're likely to find.
Exactly.
So the first thing is the redness when you're talking about inflammation. The other thing is it gets swollen. So it may not be possible to see the swelling when you're looking at it, but anytime you're talking about inflammation, you're talking about is also pain.
Okay.
So most of these people will actually have pain, redness, and swelling. Those are the three things that are very common when you're talking about inflammation. And so when you're looking at conjunctivitis, it means that white part, which is the conjunctiva, is inflamed. And there are several causes, as we will see.
And it makes me wonder because this condition has hit deadlines over the past few months, this year actually. And has it just started, or were people not getting it before?
Well, it's been there.
Yes.
What has happened is, if you look at the past few years, when you had COVID, so people were washing their hands, they were sanitizing. There was no shaking of hands. Yeah. People are very hygienic. And one of the main things that is triggering this disease is actually the hygiene levels. Okay. Because one of the things you learn about and we see with conjunctivitis, it's highly transmissible. So if a person has it, they can easily transmit to the next person. Okay. So if you just rub your eyes, and maybe you had greeted someone who had rubbed their eyes, handshake. So those are things that had gone away with COVID, as people were washing their hands. So now we are seeing it coming back. Okay. And the problem is, once one person has it, and if you look at also the timing, it was during the school opening. So children are the ones who actually spread it very fast.
Oh, really?
Also because of the dust. So if there's a lot of dust, one child gets it, then the next person gets it, and they keep spreading. So such that you now find there are so many people who are actually getting the conjunctivitis.
And why especially in the coast region?
I would say one, it's hot.
Okay.
And then also the environment favors like the viruses easily to grow. So immediately one person has it, then it keeps now spreading across.
Okay.
Yeah.
And you've spoken about the viruses. So
yes.
How does this now conjunctivitis come along? How is it caused?
So as I said, it's a disease of contact.
Okay.
So that's how it spreads. So the moment one person has it, and they just rub their eyes and even greet you or touch you, then the next person gets it.
Is it viral? Is it bacterial?
So there are different things that cause it.
Yeah.
It can either be bacterial. So bacteria, there are certain bacteria that are very common that cause conjunctivitis. Can also be viral. A common one is the adenovirus. That's the one. Adenovirus. It's called adenovirus. That's actually the one which is responsible for most of the eye infections. We also have sometimes people get allergic conjunctivitis. So you find it's very common in people who have things like asthma, people who have like they itch a lot, so they get a lot of what is called allergic dermatitis from the skin. So people with those kind of, so some people will
Is
present...
that eczema? Sort of.
Not eczema.
Yeah.
So it's a form of allergy that people have, like when they come into contact with certain things. So you find a lot of that inflammation happening on the skin. Also the same one that triggers these things to happen in the eyes. So in fact, for someone with things like asthma, one of the things we also want to find out is whether they're having any redness, or anyone in the family gets this kind of redness, or if they itch, or if they sneeze, because also we have what is called allergic rhinitis.
What? These itis have become too much.
So allergic rhinitis are people who come in now with things. So because all these are allergies.
Yes.
So they'll be sneezing a lot. They have a lot of mucus. Sometimes they'll choke because of the phlegm going back to the throat. But they have that condition called allergic rhinitis. And probably you'll find it's happening at particular times of the year. So like during, I don't know hay fever. So like during when they're harvesting, or even when there's a lot of dust. So these people will also have, so they'll be having red eyes, the pink eye, the conjunctivitis, but also they'll be sneezing a lot. So that one comes in as one broad category. Yes.
Oh my God.
So maybe anajikuna, sneezing, your eyes are red. So that's a very common thing among people who have allergy problems.
And now talk about this pink eye and how they manifest in children. So are the symptoms worse than adults?
So the symptoms are for conjunctivitis is the same. So irrespective of whether you are an adult or a child, and most people will come in, the first thing is they will complain of pain. So they'll actually, the reason why, because remember I told you when you have inflammation, you have pain, swelling, and redness. Those are the common symptoms. So they'll have pain, and sometimes they have a problem with the light. So for example, if the light is not, so they get affected by the light, so they'll tell you, hey, macho yangu inauma.
Kwanza hizi zetu usiki kwanza inauma, mpaka nikaanza kushuku, is this conjunctivitis? Because normally looking at the lights for production, you're like, you need to dim that one. Yes.
So sometimes it happens, which you made me also. There are people who, I know one of the things that people are making fun of is the people who are into drugs.
That is very true. Very, very true.
Because people also taking some drugs, like marijuana and others.
Especially at the coast.
Coast, yes.
Most of them.
In fact, I saw some videos on TikTok. People saying, people thinking they've taken drugs, and people are, because their eyes become,
Okay. So any other symptoms that manifest, especially in kids?
So as I was saying, there's no most of these conjunctivitis, it will present the same in adults and children. So as I said, the common thing is pain, redness. That's what most people will complain about. The other thing people tend to note is, especially for bacteria, when it's a bacterial conjunctivitis, they get a discharge from the eyes. So asubuhi unaamka, your eyes are closed, they can't open. So and also is also very among children. Sometimes when kids are born, wanapata ile tunaita neonatal conjunctivitis. So especially if the mother had diseases like gonorrhea and other sexually transmitted infections. So sometimes the kids will present with those discharge. In fact, when they are born, one of the things we always give them is what we call the tetracycline eye ointment. And you give them to prevent those infections. So utapata sometimes, especially in newborns,
yes,
the eyes becoming red and having that discharge.
Oh, really?
Yes, but that is usually as the child was getting delivered, they get infections along the birth canal.
So everyone needs to get that. Every child
Yes,
needs to
every
get
child akizaliwa na ekanga.
Okay.
Yeah.
So akipewa BCG pia anapewa hii ingine.
Ndio asipate those eye infections.
Okay.
Of course, if now they present with na hiyo discharge na redness, then we're able to know and give them the same treatment.
Okay, that makes sense. And now for adults, it's still the same.
So adults mostly to be the same, so they'll complain of redness. Sometimes there may be pain or not, but most of the time they'll have some pain. Sometimes wanasikia ni kama mchanga.
Oh, in
They
the
come
eye.
and they come and tell you ni kama kuna vitu zimeingia kwa macho and you can't get rid of them.
Some of us get that a lot when you put these eyelashes. That you see.
Actually, talking
on
of
a light
which,
note.
you see trauma to the eye, especially umesikia watu wamepigana, because those are other causes of now conjunctivitis. And one of the things we always ask is, was there any, especially, so conjunctivitis will affect both eyes. Utapata, sometimes it can be just one eye, but it tends to spread to the other eye. But sometimes one of the things we ask is, was there any history of trauma? Mulipigana na mtu.
Okay.
That one, they also have now what you call the black eye.
Yeah, by
So,
the black eye.
Yeah, so, but to be red, there'll be that inflammation of that. Yeah.
And at this point you need to ask, were you on, because these lashes you put glue on them, especially if you're not putting the one-on-one. You need also to ask if that was a factor that has led to this. But as we continue...
Yeah, because those are chemicals. You see, when ukiweka that chemical, and that's why you're talking about, so utapata, especially for ladies, ukiweka hizi eyelashes. So it can either, the eyelash itself can affect it, ama if you're using, like you're saying, I didn't even know you use glue.
Oh, sorry, nimetuibisha. Poleni.
So that can be a reason, your chemical or any other chemical, or people working in industries, for example, if it splashes to the eye, so that can also cause that inflammation of the eye.
Okay, and if I have these symptoms, how now is the diagnosis, how are the tests done when I come to you?
So the first thing, it's usually what you call a clinical diagnosis.
Okay.
So daktari atakuja, we see you, and it can easily, we'll just know, like your eye is red, but we need to examine, because one of the things, as I mentioned, we need to find out what triggered it. Did you come into contact with someone with the same illness? Maybe there's like now we know if someone presents in Mombasa with that, we suspect it's the same infection spreading around. But if it's an isolated case, then we need to know did you put any chemical? Niyo glue umeka. So, but is it any other chemical, especially for people working in industries? We need to find out, because you realize sometimes it's just conjunctivitis, which looks mild, but you may be affecting the other parts of the eye. Remember, the eye has different, like the retina, and so some of these sometimes actually irritate the iris, and there's a lot of other issues. So we need to find out what exactly happened, if there's any chemical, if there's any trauma, kama uligongwa or anything, any contact with people, discharge. We actually ask a lot about the discharge. And of course, the most important is we ask about your vision. Because some people, mostly conjunctivitis will not give you an issue with vision. So you'll still be able to see clearly, other than just that irritation. So we have to test your vision. So kuna ile tunaitanga Snellen chart. There's a chart we usually ask people to read.
Oh yeah, the small one.
Yes. So you stand about 6 meters, so you're able to assess that, because we want to find out Other than, because sometimes some things appear mild, yet there's more happening. Because sometimes other causes could be something to do with the blood.
Blood?
Yes. So, for example, we've seen blood. People with things to do with like people also on medication like blood thinners. So sometimes
for the heart condition.
Yes. So sometimes because of that, the eye can the small, what I call the capillaries, the small blood vessels.
Yes.
Sometimes they can rupture and cause that. We've seen also with people with hypertension. So mtu anaweza kuwa the blood pressure was very high and the small capillaries can rupture. So we need to check all those things. So atuangalie tu the macho inaweza kuwa is the only thing that they've come with. Then they have other underlying conditions. We check their sugar, their blood pressure, especially for the elderly patients. Wakikuja na all these symptoms, you have to examine and make sure you're doing a thorough exam. Sio tu macho. So we have to check everything else.
And I've heard it's currently reached in Nairobi. So are there many cases?
So we are seeing one. There are not so many, but you see what happens with these infectious diseases. Inalanga a few cases, then before you know it, especially among children, because it's very hard. Most kids, maybe they're not washing their hands, they're playing in the dust. So the moment one child gets in a school, it's very easily spreads to the rest of the school. Yeah. And then from the school, now it's taken home, because that's how it spreads. Yes.
What are you supposed to do when you find out you have it? Are you supposed to?
So the first thing is we advise is hygiene.
Okay.
So don't rub your eyes, which is difficult because it's irritating.
Very difficult.
Yes, because you see the moment you rub your eyes, if you don't wash your hands, kama ilikuwa kwa macho moja, the next minute it's spread to the other eye. Yeah. You fail to wash your hands, mpatane na mtu, you say hi, people are into handshakes, so you easily spread to the next person. And all you need to do is touch your eyes. Yeah. That's how it spreads.
So as doctors, do you advocate for isolation?
Isolation is a bit extreme, but that would be the ideal thing. If you have it, okay, but it's difficult. I think the best thing we advocate for is good hygiene, making sure you're washing your hands, you're not shaking hands with other people until you recover fully.
How long does the disease now stay with you? Is it a disease or an infection? What can I call it exactly? Or a condition?
Well, they all mean almost the same, but so conjunctivitis is more of a symptom. So you need to find out, is it bacterial conjunctivitis, then that's the infection. Is it viral, is it trauma? So it's a symptom that you need to find out what is causing it. Okay. Yes.
So how long does one portray this?
So the same thing, so it depends on what caused it.
Okay.
So if it's bacterial, usually by the third, fourth day, that's when it's so people have a lot of redness, a lot of discharge. So immediately you start treatment. The good thing with conjunctivitis, it responds very fast. So once it's diagnosed, we start the antibiotic, either the ointment or the drops. Ukishaanza within about 24 hours, we see a lot of improvement of most people.
Really?
Yeah.
Okay.
So it's a very, not unless now you have other causes of the conjunctivitis. So like people who are diabetic, the hypertensives. So until now you control their pressure, their sugars, then the conjunctivitis may persist for some time. Okay. Or people who have, like I was talking about the blood. So in some people they'll come in and they have the conjunctivitis and maybe they have bleeding from other areas. So like their gums are bleeding, their passing urine has blood or stool has blood. So if they are bleeding from other areas, in case, there's, for example, if you get any trauma to any part of your body, inafaa ina bleed kidogo inaisha. But for these people, what you call the bleeding time takes longer. Then you need to find out, are they having other conditions of the blood? So like, do they have their platelets? How are they low in what we call thrombocytopenia? Or do they have any other blood abnormalities? So those ones will be determined by how the person comes in.
Okay.
Yes.
And we just want to take a short commercial break because after this I want you to talk about the treatment processes.
Yes.
We can even discuss further on perhaps is there a natural way to just let it slide if there's anything like that, and you're going to talk to us more about that.
Yes.
We take this short commercial break. Remember, this is Health and Wellness. Don't go too far. Welcome back to Health and Wellness. My name is Zaitun Ali, and if you're joining us, you're not too late because we've been discussing about the conjunctivitis, commonly known as the pink eye, or right here in Kenya as the red eye. In case you have any questions about it, 22151 is our SMS line. You can also find us on our social media handles at KTN Home, at Ali_Zaitun, both on Instagram and Twitter. So we're still here with Dr. Msafiri. Welcome back. And we were talking about what causes it, how we can diagnose it, and the tests that are done. So right now we want to talk about the treatment process and how we can prevent it. So, Dr. Now we have it. How do we treat it? Especially now that you mentioned the categories, bacterial, viral, allergic.
So, as I mentioned, the first thing is to find out what caused it. One, as I said, there are no specific tests that you can do to know that this is bacteria. Hii si ile ya kwenda kutoa damu. Ama we take an image. So it's a clinical diagnosis. The doctor is able, from your history, the way you presented, you're able to tell if it's bacterial, viral, or any other cause. So from that history, the doctor asks, then you're able to make a diagnosis. Once we've made a diagnosis, we're able to know if it's bacterial, then we give you antibiotics. Not for swallowing, but antibiotics that you put in your eye. So they come in as
like a drop, eye drop.
The eye drops. So you'll find actually most of the eye drops have the antibiotic, and some of them have what you call a steroid. That's why the doctor needs to find out what is the actual cause. Some of the conditions in the eye, if you put in steroids, it can actually get worse. So that's why we ask people not to do over-the-counter medication. Sababu anaweza pewa hizo steroids or any other that will actually make the condition worse. So it's good you have a doctor have a look. Ndio pia angalie, amulike ane ndani ya macho, they're okay. And then we're able to know. So they'll get that antibiotic. Sometimes it could be a fungal, which is also very rare. So they can put for you those antifungal.
Inside as well.
Yeah, all these are eye drops.
And how do you deal with this treatment, especially with babies? Because they cannot even stand in putting anything in the eye. You don't have anything to swallow. It has to be the eye drops alone, or?
So eye drops is what we give, and the main reason is because they get absorbed in the eye.
Okay.
But there is a problem.
Okay.
Ukimpea kumeza, unless they have a very severe infection that is affecting, because remember the eyes are also part of the brain. So if there's a problem in the brain, then that's when you need to give something for them to swallow, what we call system. But kama iko tu kwa macho, then the eye drops are just enough.
Okay. And we've been talking about it. I can see you have an eye here.
Yes, so this is mainly to show. So if you look at it, the blue part in this case is what is when you look at the eye is white. So it doesn't mean.
So this is the blue part is the white part. You're the eyeball.
You're the conjunctiva.
Okay.
The eyeball is all of it.
Okay.
Then you can see you have the front is the lens. Hapo katikati is that's the area that opens into what is called the retina. They call it the iris. Black. The black part is what is called the iris. So conjunctiva affects the blue part in this demo, but inafaa kuwa white. So it's just for demonstration. The blue part is what is called the conjunctiva.
Okay, no problem.
So hiyo ndio that inflammation. So when it gets inflamed, it gets swollen, inakuwa red, becomes painful. When it gets affected, then you're able to know that there's a problem with the conjunctiva.
Okay. Is there a point whereby I can just let this infection slide and it heals by itself? Is it possible?
So if you have remember some of the conditions we said were like allergic conjunctivitis.
Yeah.
So with allergic conjunctivitis, sometimes you can just let it be and it clears without any intervention. Same thing with the viral. Most of the time it will irritation for a few days. If it doesn't get on top a bacterial infection, then it will take maybe 5 to 7 days and it will clear by itself. Without any intervention. Of course, the other thing we say is people can use, one is to prevent putting, you have had kids wamekewa maziwa, wamekewa
even salty water. People even ask about salty water.
Yes.
Naweza tumia ni kande macho.
So some of them may help, but one of the things we advise is don't let the doctor advise. Because there are many causes of this. So unaweka kitu kwa macho and they react, becomes even worse. So you start now affecting even the iris and the other places where some people actually end up with they need to be careful, otherwise we've had people put things in their eyes which now affects them even more than they had come in. So usiweke anything kwa macho without the advice of a doctor.
Yeah. So you had talked about the eye drops, especially the antibiotics in ndani. So for not the viral one, the allergic one, now you put antihistamine.
Yeah, so there are some antihistamine you're able to put. And then if they have other symptoms, and for those ones now we can ask them to take antihistamines orally. So
orally?
This idea pia to reduce other the same problem if it's affecting, like kama kuna rhinitis, the one I talked about. So then they need to take them orally.
You had mentioned even before about conjunctivitis is in relation to at times sexual transmitted infections.
Yes.
And babies, when they're born, they get it. So is it babies alone, or once you have got that STI unaweza pata pia wewe kama mtu mzima?
So it's very rare to get the problem is saying that ukiona mtu ako na macho red unafikiri it's not a sexually transmitted infection. It only affects children, and the main reason is because I talked about the birth canal. As a child is getting born, kama amefanyiwa CS, then it's unlikely atapata this kind of a problem. But for children vaginal, done in a normal delivery, vaginal birth, and those ones are highly likely to get the conjunctivitis if the mother had sexually transmitted infection. Yes, so it's not the adult, it's the baby. Yes.
So aside from the medication, is there anything that can relieve all these symptoms?
So sometimes people put either like a warm water, and you can actually just put it on top to try and cool the problem. If the pain is too much, then they can take painkillers orally. So wanakunywa painkillers, and that will help with the pain. And sometimes the wearing of shades, as I said, sometimes these people get affected by the light. So kivaa shades so inasaidia na reduce that effect of the light. Yes.
So that is well noted.
Yes.
And at least we've talked about all the treatment.
Yes.
So for prevention, how do we ensure it does not get to us?
So the first thing is the moment a person notices they have this, they need to seek treatment early. Because as I said, it spreads from the first person to the other.
Yes.
So the person who gets it first, they notice they have a problem, then they need to go ahead and get treated. So once we treat the first person, then we've actually reduced the chance of it spreading. Then for that particular person, they need to maintain a good hygiene. So wanna make sure anaosha mikono. So if you remember, Wasema not touching your eyes,
your nose, during
your
COVID
mouth.
time. Yeah.
Do it or men, avoid men.
Really? Okay, that is so true. And nowadays, I think we will also do the same because kama imefika Nairobi, we need to take action. But again, there are myths and misconceptions everywhere. If I cough, Daktari Msafiri will get it. So is this true?
No, it's more of contact. It's a condition that is spread by contact. So if you cough, it's unlikely that kutakuwa na any.
It is not airborne.
It's not air. The only thing that sometimes happens is the dust. Because remember I talked about for kids who are playing outside, people traveling in a very dusty area, the dust entering your eyes can cause that irritation and now give you the conjunctivitis. But for others like viral and bacterial, usually it's contact. So utapata somebody had it.
Yes.
Wakakusalimia au rub your eyes and that's how you got it. Yes. That's how it spreads. It's usually through contact.
Yeah. Okay.
Yes.
So now we've treated it and we've successfully managed to heal from it.
Yes.
Can it reoccur?
Yes. It's
really?
not yeah.
It's not a one-time thing.
Si ati nakuja unapata immunity.
So it can come back again.
Yeah,
if you're
you've even
careful.
seen people treat this week, they go back to the same environment, somebody else has it, they touch their eyes again and they still come. That's actually why you see a lot of cases happening. You may find it's the same people having it
over and over again.
Yes, because as long as people are not washing their hands, basically that hygiene is the main cause for this. So people really need to go back to what you used to do during COVID. Sanitize your hands, wash your hands, avoid touching your eyes, which sometimes is difficult, but you try and avoid that as well. Yes. Okay.
Some of the facts that perhaps most of the people don't know about this infection. Now I'd like to call it an infection. So what are some of the factors that they don't know about, the risk factors and facts just about it in general?
So one is maybe a few myths about just some people also merogwa this area ama ni maji. Sometimes when you have like in the swimming pools, we've seen also people coming especially because of chlorine. So true. Chlorine, remember I'd mentioned about chemicals. So sometimes people when they swim a lot of salty water can also cause that irritation, and that's why maybe people thought it's happening a lot in the coast region. Yeah, but people have been swimming there for long. So it's still that infection in a cause. So mainly either viral, bacterial, allergic, or is a environmental, those chemical irritants. Or trauma, mtu amekugonga. So those are the main causes,
that they need to know about it.
Yes.
Okay, thanks. At least we've learned a lot from it. And there are points I've mentioned about red eye and pink eye. So normally everyone is assuming it has to be red. So what is the natural color of the eye?
So as I said, the eye has different parts.
Yes.
So the white part, it's supposed to be white.
White. Lakini yako si white, daktari.
So what happens if you look at a newborn? All ndio wako white. But as you're growing older and older,
I have brown eyes. Mine is a little bit yellow. So people need to know.
So inafaa kuwa white. But as people age, the color changes. Mainly because of the sunlight. However, the other conditions zinaweza. So a common one right now, I know we are talking about the red eye, but sometimes you've seen people with yellow eyes, for example. Ile tunaitanga jaundice. That's something, that one is different from what we are discussing.
Especially for the babies again.
Yes, so babies, they'll have jaundice. Jaundice is totally different from what we're talking about. But that means the liver is affected. So unapata that area where it's supposed to be white, inakuwa yellow.
So they need to know that.
But that one will have other areas being yellow as well. So you'll find their skin, mikono, ukiangalia mikono iko yellow, the color of urine changes.
si macho peke yake.
Si macho peke yake. Even the stool, jaw, inakuwa interesting, inakuwa white when the liver is affected. So yeah, because the pigment inafaa kuwa gives the stool the color is not there.
Okay.
So especially for what we call kama imefungana obstructive. So there are stool color changes. So for that person mwenye akona jaundice, they'll have these other conditions. So that one is different from what we're talking about today.
Okay.
The other thing we see is sometimes people come in ile imefura, the eyelid. What we call, people call it the sty.
Sty.
Yes.
So there's a difference between that.
Yes. So that one ni the eyelid.
Okay.
The lower part. Usually it gets either, mostly it's an infection, so it swells.
Is it the myth that people say ukinyima dogi chakula, if you don't give a dog any food, now it comes here? Ama ukiangalia mtu mwenye akona, it comes. So there are very many myths. Is it the one?
I don't know about the myths.
No, is it that condition that at least unafura kwa eyelid? But what is it? What causes it?
So usually what happens is kuna ile the normal flow of both the tears, and so there's a way they flow.
Yeah.
So any obstruction in the flow of those fluids, in, for example the eyelid ama infection yote kwa eyelid, inafanya inafura. So that one is different, and the treatment usually sometimes they need to go and get drained, but this is done by an ophthalmologist. So yeye ndiye anaenda anatoa that. So you need to go to an ophthalmologist, angalie, aone, and some of them will just give you antibiotics. Hizi sasa atakupea za kumeza.
Okay.
And it will go away.
Okay.
But you need to go to the doctor and you angalie aone what is cause.
Yeah.
Yes.
And lastly, even as we're winding up, those who normally wear contact lenses,
Yes, so
they get affected as well.
So for someone wearing contact lenses, that's why we insist on very good hygiene, making sure before they change their lenses, they wash their hands.
Yeah.
Because remember I said conjunctivitis is spread through contact.
Yeah.
So mtu asipoosha mikono vizuri, make sure they're storing their contact lenses in a clean place. So hygiene is very key. If someone can't have a good hygiene, then they should not be wearing contact lenses, because they tend to get a lot of recurrent infection in the eyes.
Okay, that makes sense. Thank you so much for the information.
Yes.
In case anyone finds such and similar symptoms, how can they find you?
So, like you said, today we are here at Rehan.
Yeah.
Rehan Healthcare. Usually we are on first floor of Park Medical Center. That's on that Parklands Avenue opposite Aga Khan. So you can come and find us there.
Okay.
So we can see you from there. Alternatively, you can, as you heard, my name is Daktari
Msafiri.
Yes.
I can't even remember his real name because that title has stuck in my mind.
Yes.
All through. Yeah.
It's because we come to where you are. So you can either come to our clinic, or if you're not able to, we come to where you are.
Okay.
Yes.
How can they contact you?
So they can call us. Our number is 0720 744 389. Yes.
Thank you so much for sharing all those insights to us.
Yeah.
And you will also be able to see a couple of features right here about conjunctivitis. So stay tuned. This has been Health and Wellness. My name is Zaitun Ali. Thank you so much for watching from the start until the end. Goodbye.